For patient Jimmy Welch, early detection of his prostate cancer led to an early discussion with his doctor on the best method of treatment. They considered the standard treatment radical prostatectomy, which is the surgical removal of the prostate through a large open incision in the abdomen. But Jimmy knew of another option.
Dr. Pearson was telling me all these choices I had. I said, wait a minute. I said, I want the robot type surgery. He said, oh, I'm going to get to that. So we do that here now.
That's right, he said robot, as in the Da Vinci robot.
Okay, you ready to go?
The Da Vinci surgical system is fast becoming the standard means of prostatectomy for patients with low-grade prostate cancer.
If the tumor's localized, if the patient's in good health, meaning he's a candidate for surgery, and if the prostate is not too large, if the prostate is no more than 2 to 3 times normal size, then that person is an excellent candidate for robotic surgery. And that would be the majority of patients.
Any surgery involves very precise movements. That's especially true with prostatectomy. The goal is to remove the prostate without disturbing the intricate maze of nerves and blood vessels that control sexual and urinary functions. Da Vinci welcomes that challenge with open arms. 4, actually. One holds a state-of-the-art camera, giving the surgeon the closest, clearest view of the cancer.
The Da Vinci system has several features that vastly improve exposure. One is magnification. The image is magnified 10 times. One is stereoscopic vision that allows the surgeon to actually see in 3D.
The robot pretty much works like a video game. Joystick-like controls called masters are used to move Da Vinci's arms inside the patient. For surgeons, those delicate motions of cutting and stitching are still right at their fingertips.
It has all the motions of the human wrist. It can move in 6 different directions and simulate all the motion of the human wrist.
Another distinct advantage with Da Vinci is that the device is inserted through small ports. That leaves much less scarring for the patient.
So what the patient experiences is less discomfort immediately after the surgery, a shorter hospital stay, less blood loss, which means a quicker return to normal energy levels.
I've never had surgery before, and I always heard people talk about, oh, you're going to feel bad and you ain't going to have no energy. It takes you months to get your energy back. It didn't me.
Robotic surgery may be the future of healthcare, but don't worry, it won't be putting any real-life doctors out of work. In fact, the system cannot be programmed to perform on its own. Rather, Da Vinci only supports the true artist of the operating room.
I'm very impressed with the ability of this technology to improve the operation. So this is extremely cutting edge.
For Smart Medicine, I'm Rod Starn.